My name is Carrie Ann Schmidt, and I'm a physical therapist here at Regional Medical Center, and I've been employed here since 2014. I have been doing pelvic floor therapy since 2016, and my passion for pelvic floor therapy actually started because I needed pelvic floor therapy myself. We hope this video will give you information that will be helpful throughout your pregnancy. The body changes in so many ways during pregnancy. Your center of gravity moves forward, which causes more pull on the low back and the pelvis. The pelvis then tilts forward, causing your abdominal muscles to get stretched and become weaker. It's always good to focus on good posture. When standing, imagine you're wearing a crown. Pull your head back until your ears are in line with your shoulders. Lengthen your spine and let your hips and ankles align with your ears and shoulders. Stand sideways in view of a mirror to do this. You may also need to tuck your tailbone forward to correct for the change in your center of gravity. When sitting, follow the same directions for standing. Try to maintain your general fitness to stay comfortable as your body changes during pregnancy. Try to exercise 3 to 7 days a week and try a variety of activities. Always include a warm-up and a cool-down. Build your strength and endurance gradually, and then the intensity can also increase. Low-impact aerobic exercise is the best because it doesn't involve movements that can strain joints and the pelvic floor, such as jumping and running. Exercise during pregnancy not only makes your body prepared for labor and delivery, it is also found that recovery after birth is much better as well. Consult your physical therapist or doctor if you have any more questions about exercise during pregnancy. It is also important to reduce harmful stresses in your life and practice relaxation techniques such as meditation and yoga. Stress can be harmful to you and your baby. How does sex feel? It should never be painful. You may need to try different positions. Sex is perfectly safe during pregnancy, but you should always talk to your doctor about this to be sure. It may be up and down as far as the desire for sex. Hormones play a huge role in this. As you progress through your second trimester, many notice a slightly stronger libido and experience more sexual pleasure. Your pelvic floor muscles consist of 3 layers of muscle that have varying functions. The innermost layer, layer 3, is connected to the base of your pelvis and acts like a sling to support the pelvic organs. Layer 2 is specifically responsible for holding urine in. Layer 1 is the most superficial layer, making up the outer brim of our vaginal opening. Learning to connect to these muscles during pregnancy is very important for many reasons, with the most important being that it will always allow you to get these muscles well prepared for delivery and to give you really good support as your uterus and baby grow. For proper functioning, pelvic floor muscles must have a good muscle length, good tone, good symmetry and coordination, as well as good strength, responsiveness, and endurance. What is a Kegel? A Kegel is a pelvic floor contraction where all 3 layers should work together and tighten. To check the function and strength of your pelvic floor muscles, try these things. Number 1, while urinating, partially empty your bladder, then try to stop the flow. Only do this test about 1 to 2 times, as any more often it may interrupt how your brain and your bladder communicate. Number 2, think of making a rosebud by squeezing your vagina together and pulling it up and deeper. Number 3, you can also try sticking 1 to 2 fingers up into your vaginal canal and tighten your pelvic floor muscles until you feel them squeeze your fingers. The tighter the squeeze is, the stronger your muscles are. Pelvic floor muscles can be weak, but they can also be very tense. If you are having difficulty with feeling the muscles contract, you may first need to learn how to relax the muscles before you go to try exercise and strengthen them by doing Kegels. You may experience some of the following problems if your pelvic floor muscles have a high amount of tension: pain in the vagina, rectum, tailbone, sacrum, lower back or hips, straining or difficulty with bowel movements, pain or discomfort during intercourse or orgasm, or any urinary issues such as trouble starting to urinate, stopping and starting the flow, not completely emptying your bladder, and pain while urinating. If you question your ability to perform a Kegel properly or have developed pain or discomfort while trying them, stop the Kegels immediately and come for a pelvic floor evaluation by a physical therapist. To perform a Kegel, start by laying on your back with your knees bent. You can progress to performing Kegels in sitting and standing because that is how we live. Imagine your vagina as a large, beautiful rose with its petals fully open to absorb sunlight. Now try to tighten your pelvic floor muscles, thinking about making that rose back into a rosebud. Squeeze your vaginal opening closed and then imagine pulling that rosebud up and deep inside of you. Make sure you are not holding your breath and not using any abdominal muscles, hip muscles, or leg muscles to help. Then let those muscles fully relax for 5 seconds, thinking about making them back into that full blooming rose. Start out by performing Kegels for a 1 to 2 second hold. Perform 10 reps. Then perform 5-second holds, 10 reps. Kegels should be performed 3 times a day so that you are performing about 24 to 48 repetitions per day to get the best results. Deep diaphragmatic breathing. Your diaphragm is at the base of your rib cage, and when it contracts, it pushes down into the abdomen to draw air into the lungs. As your belly and baby grow, it's going to be harder and harder, but this is still really important to learn how to fully use your diaphragm. Diaphragmatic breathing can help during labor and delivery and will be so important to know how to do this after the baby arrives. To perform proper diaphragmatic breathing, place one hand on your chest and then another hand on your belly. Take a deep breath in, thinking about filling the air down into your belly and pelvis. Only our belly should be rising. No movement should be happening to the hand on your chest. Inhale for 3 to 4 seconds. And then exhale for 3 to 4 seconds. Transverse abdominis contraction. The transverse abdominis is the largest and deepest abdominal muscles. Unfortunately, it is the first to become stretched out during pregnancy and is the last to remember how to work following delivery. It attaches to the lower 6 ribs, attaches to the front of your hip bones, attaches to the pubic bone, and then wraps all the way around to your spine. Keeping this muscle strong during pregnancy helps you maintain good posture, keep your core stable, avoid pain in your back and pelvis, and helps you actively push your baby out. Starting position, sit upright with your back supported against a straight back chair or wall. Inhale deeply, performing a good diaphragmatic breath, letting your abdomen fully expand. No rise in your chest should be happening. Slowly exhale, bringing your belly button towards your spine and envision pulling baby towards your spine. Make sure you can hold the contraction to continue to breathe. Hold for 5 seconds, perform 10 reps, and do this 3 times per day. Next, pulse the contraction by releasing it just slightly as you inhale and then tightening it as you exhale. Pulse the contraction 10 times, 3 times a day as well. This exercise may also be done in standing, laying on your back, or even on your side. General stretches for your back and hips. First, I'm going to describe how to do a pelvic tilt. You're going to lay on your back with your knees comfortably bent. You're going to think about pressing your low back down into the table, contracting muscles in the abdomen, tilting your tailbone up. Hold for 5 seconds and relax. Next is cat-cow movements. Go ahead and get on your hands and your knees on a comfortable surface. You're going to think about arching your back up towards the ceiling as if someone was pulling on your bra strap. And in cow, you're going to relax the belly, arch your back, and let your tailbone stick out. Nice, smooth, gentle movements between cat and cow will allow for good flexibility of your low back. Hamstring stretch. Lay flat on your back with your legs stretched out straight. Bend one knee up and grab behind the knee. You're going to gradually straighten that knee as much as you can until you feel a stretch. Hold it for 20 to 30 seconds. Relax by bending the knee and do 3 on one leg before you switch to the next. Piriformis stretch. Lay on your back with your knees comfortably bent. Cross one leg over the other and grab that knee with both hands and pull towards your opposite shoulder. A stretch should be felt on the outside of your hip. Hold for 20 to 30 seconds. Do 3 times on one hip before you switch to the other hip. Glute figure 4 stretch. Lay flat on your back with your knees comfortably bent. Cross your right leg over your left leg. Take your right hand through the hole to grab behind the backside of your left knee. Pull that left knee closer to your chest, and you can use your right elbow into the right knee to increase the stretch of your right hip. Hold for 20 to 30 seconds. Do 3 times on one side before switching to the next. Butterfly stretch. Lay flat on your back with your knees comfortably bent. Then allow your knees to fall out to the side, allowing the bottom of your feet to come together. Rest in this position for 20 to 30 seconds. Then bring the knees back together. Do this 3 times to fully stretch the muscles of your inner thigh. Squat stretch. Stand next to a chair or a countertop for balance. Spread your feet about hip width apart or a little further. Drop your bottom all the way down and use the elbows on the inner portion of your knees to further spread them apart. Hold for 10 to 15 seconds and then stand back up. Happy baby stretch. Lay flat on your back with your knees bent. Then think about bringing both knees up towards your chest. Keep them wide as you reach for the inside of your feet. Grab your feet and gradually think about pulling those knees closer to the floor or the bed. Downward facing dog. Start on your hands and knees, and when you feel ready, curl the toes under and push your bottom up towards the ceiling, keeping your back straight and your hips drawing higher and higher towards the ceiling. Hold for 10 seconds and then relax. Child's pose. Start on your hands and knees and spread your knees further than hip width apart. Allow your bottom to draw down towards your heels and rest on your heels. Stretch your arms out straight in front of you as far as you can to allow your forehead to rest on the surface of either the bed or the floor. Hold for 1 to 2 minutes or however long you would like. As your bladder becomes more and more compressed because of your growing uterus and belly, you may have more success fully emptying your bladder by simply leaning forward, placing your elbows on your knees. This will help bring the bladder more forward and allow for the urine to exit. What is a squatty potty? A squatty potty is really a glorified step stool that brings your knees above the hips. We have this connective tissue that surrounds and covers our intestines, and when our knees are at hip level or below, like on most high-rise toilets, this causes an increased tension and compresses the intestinal tract, making it more difficult for things to pass through. When you use a step stool or squatty potty to bring the knees above the hips, this causes that connective tissue to have slack and allows for easier motility throughout the system. It also changes what's called your rectal anal angle. It tilts the pelvis in a way that allows for more of a straight angle from your rectum to out your anus. If you have any questions or concerns about anything that you heard today, please mention it to your doctor. And if it's of any benefit, I would love to see you for pelvic floor physical therapy.